Thank you. Thank you very much. Good morning. How's everybody doing? I am extremely honored to be back at my alma mater, and I'm excited because Tim Koss, the president of the university, is doing some amazing things here. And it's my second time back in the last 6 weeks, and I'm just amazed at all the excitement that's taking place here on campus. And I'm more excited about the fact that my first discussion with the new president as he came in, we had a little discussion about some past fines that I had from parking. And he has promised me that if I can get some deliverables this session, Mr. President, that those parking fines will disappear, I guess would be a better way of saying that. So. It actually is true. I think I had to wait like 2 weeks to get my final transcript from Jacksonville University because I did have parking fines. So if anybody who's doing any digging on me, you'll find that out. My driving record is not flawless. But I want to say I'm really happy to be here. I've got some other legislators from the House and Senate that are here. Really happy that y'all took the time to come to this conference. And Rick, thank you for showing leadership here in Jacksonville, Florida, and for the state about having really serious discussion about serious public policy issues that are facing our state. I think that we need more institutes like this. This is a wonderful opportunity to have an exchange in ideas. I'm also very glad to have my partner in the legislative process, Senate President Don Gates, here with me. Originally, I was going to be the only one that was here, and I reached out to Rick and I said, you know, the Senate President and I, we actually get along. That's a rarity in Tallahassee. But we've been traveling the state together for almost a year, before session, after sessions, talking about what we have done, what we want to do, but more importantly, listening. And I just have to tell you, most people, they go into the political process, and the Senate President and the Speaker are really close and say nice things about each other on the first day of session. They mean about half of it. By the end of session, they're not even talking to each other. I've watched this time and time again in the political process. Not only is Don Gates my good friend on the first day of session, he was a better friend on the last day of session. He's a man of great integrity, and I'm so happy that you're here, Mr. President. So thank you for joining us. Florida's on an amazing hot streak, and I'm not going to talk much about that, but I just think you should be aware. The unemployment rate in Florida is at a dramatic low. It's at 7%. 2.5 years ago, it was at almost 13. We have almost 1,000 people moving back to Florida a day. We had 92 million visitors visit the state of Florida last year. We're hoping for 100 million this year. There are some really exciting things that are happening in the state of Florida. But we have some real challenges, and we all know what they are, and there's infrastructure challenges and water challenges and education challenges that face the state, but probably none more critical, none more important, and none more talked about than the healthcare challenges that face Florida. And what I will, on the onset of my conversation here, what I'll tell you is that I'm not proud of the fact that we have more people that are uninsured in our state than other places in this country. I'm not proud of that. I think there are things that we can do to rectify that, which I'm going to talk about. But we have a long way to go as a state when it comes to the health care of our citizens. It is a real challenge. But the one thing I think we can all agree on, because I can assure you I will say things that not everybody in here will agree with me on, but the one thing we can all agree on is that we want everyone, every single citizen in our state and in this country to have access to quality health care. We want everyone to have insurance. We want that for our citizens, we want that for our children, we want that for our parents. That is something that we as a people have decided is a priority when it comes to public policy and an investment with our tax dollars. We want to do that. I want to do that. The difference, which I'll talk about, is there are differences of opinion on how to get there, and that will be the focus of my conversation today. I also want to state on the onset, because I'll be talking about the Affordable Care Act and some of the parts of it, that I believe the President's intentions with the Affordable Care Act are pure. I think his intentions of trying to give more access to care to more people in this country are pure. I think Congress's actions were pure. I think the intentions were all good. I think the policy and the implementation of those policies has been very subpar. And I'll also be talking about that. One of the challenges that we're facing, I think, in healthcare, and we face the same challenge in education, is in economics they talk about a wedge. And the wedge is the difference between what someone pays for a product or a service and what it actually costs. And there's usually a third party in between that is subsidizing that cost. It's called an economic wedge. There is a huge economic wedge in healthcare because what people think healthcare costs and what it really costs are two different things. What people actually pay and what they think the cost of that service is are two actually different things. And so there's a disconnect in the healthcare market because people don't actually understand what they're receiving and what the cost of that service really is. So let's talk about the Affordable Care Act, and some people refer to it as Obamacare. There are several components to this law. There's some really good components to this law, and there are some that are not so good. Some great components, for example, are the fact that it allows people to stay on their family's health care plan to age 26, I believe, which is a wonderful thing, something that should have been done a long time ago. Another great part about the law, I believe, was the fact that it allows no longer for companies to factor in pre-existing conditions. I think that was a good thing. We should not be discriminating against someone because they had a health care condition at some part of their life. There's a lot of things that we can be proud of that were part of that bill. But there are some functions of that bill that passed that we're still dealing with today. It was over 3.5 years ago, that I believe are still plaguing us. And the three basic functions I want to talk about briefly with you today: one is the mandate. Second is the exchange, of course, which you've heard about already from some fantastic speakers. And third is the Medicaid expansion debate that's taking place. First, the mandate. Now, we could argue about whether or not the federal government has the authority to force someone to buy an insurance product. I think that's been solved by the United States Supreme Court. They said they have the ability to tax you if you don't buy it, and therefore, through that tax code, they can force you to buy it. So I'm not going to argue with that. But the question is, when it comes to the mandate, I believe, is if it was okay to delay the mandate for businesses that employ more than 50 people as a country just recently, even though the law says on January 1st, 2014, everybody has to be in compliance. But if the administration and the federal government said, you know what, we're not ready for prime time, and we're going to delay this for all businesses that have 50 employees or more, if it was good for them, why wasn't it good for business who had less than 50 employees? Why wasn't it good for the individuals to have a year of reprieve before they're taxed for not buying a health insurance product? There's an inequity there that I think needs to be dealt with. Now, it's not just about the mandate to have coverage. They're now telling us what that coverage has to be. And I have to say, Mr. Garrity, thank you for your wonderful presentation, and I agree with you 100%. When you read the newspaper article, it says, Florida Blue shedding 300,000 policies and leaving citizens without insurance. We know that's not true. The true case is the law is now dictating what has to be in your plan. And if that plan is out of compliance, they have to send you a letter saying we're canceling your policy as of this date. We all knew this was coming. We talked about it, and I think it's been avoided. And now there's being a lot of questions that are raised about that very policy. But I want to say, not only are they mandating that you have to have something, we're now mandating what you have to have and what has to be inside of it. And just yesterday, a person who was a wonderful president of the United States for a great time, probably was the president of the United States during the time of the most economic prosperity in modern history, Bill Clinton. President Clinton specifically said that the federal government should honor its commitment and allow people to keep their plan. And I agree with President Clinton. He's exactly right. And in fact, I joke around, I said, they shouldn't have said that if you like your plan, you can keep your plan. What they should have said, if we like your plan, you can keep your plan. That would have probably been a little more accurate with where we are today. But let's talk a little bit about the exchange, because the truth is, we all know, as was stated earlier, people's policies aren't being canceled. They have an option. They can be transitioned to a different policy through the exchange. That's if the exchange works. As of today, 4.8 million Americans have received a letter in the mail saying that their health care policy is no longer valid starting January 1st, 2014. 4.8 million, more to come. That's the number today. As of today, according to the Wall Street Journal, there are under 100,000 people who have signed up online through either a state exchange or through the federal exchange. So far, 5 million people almost have lost their form of insurance coverage today as they know it, soon to hopefully get a new form of it, and only 100,000 people have signed up. That's a problem. That's not the definition of a functioning exchange. Now, I believe, to be fair, that the concept of having an exchange and those people moving into the exchange and some of them paying less is a good one, right? There's a subsidy that's there. So some people are going to go in the exchange and find out they're paying less than they're paying today. But a lot of people are going to go into that exchange and they're finding out the sticker shock that they're going to pay more, particularly the people they need the most, which are young people from my generation who are healthy in their 20s and 30s. Those are the ones that are having the largest sticker shock and are going to be affected the most. And, I think the IT problem that we're facing with the exchange is going to solve itself. That is a short-term problem that I believe can be fixed. But the real problem, and the one that we can't answer today, is who's going to sign up for the exchange. Is it going to be people who are older? Is it going to be people who do have pre-existing conditions, and God bless them, we want to make sure that they have insurance coverage? Because if it's just them, that model doesn't work. They have to convince people that are in their 30s, in their 20s, that are healthy to participate in this exchange. And that is a structural problem right now because the evidence does not suggest that those people are signing on. And I think that's something we have to keep our eye on. My last comment on the exchange, but to give you a little bit of a perspective of the time, we spent, from March 23rd, 2010 to October 1st, 2013 was 1,287 days. That's how much time we had to prepare to build the exchange. But on December 7th, 1941, we entered a pretty big war, World War II. We declared war on Germany. And on May 8th, 1945, VE Day, it was 1,247 days when Germany finally gave up and surrendered. So to put in perspective, we entered a world war, rebuilt a military and a navy, had one of the largest countries and most powerful countries in the world surrender in less time than we had to build a website that doesn't work. That's where we are. That is reality. So the last part of the Affordable Care Act I'd like to talk about, and probably the one that has been the most contentious, the most debated, is the expansion, and whether or not the legislature and the governor should expand Medicaid in the state of Florida. Now, first thing I have to tell you, on the very first day of session, I made a statement. It was my first session that the Florida House would not be expanding Medicaid during the last session. 3 days later, I was audited by the IRS. No, I'm just kidding. I was making sure you were listening. That's not true. But you believed it, didn't you? I mean, we did have that little auditing problem. I was not part of it. I was not audited. But we did say we weren't going to do it. I want to explain to you why. We've been heavily criticized in the House. I've been criticized in the House. Our alternative plan was actually filed and sponsored by Travis Cummings, who's here today. But let me give you a little history lesson on Medicaid in Florida. In 1990, we had 900,000 people on Medicaid. In 2007, we had 2.2 million people on Medicaid. 6 years ago, we had 2.2 million people on Medicaid. Today, we have 3.3 million people on Medicaid. When I was elected, we spent $14 billion a year on Medicaid, 7 years ago. Today, we spend $23 billion a year on Medicaid. If you were looking at a pie chart and saying, how does the legislature invest its money? And you were to look at the part that funds Medicaid, you would see that piece of the pie continues to grow. And just about everywhere else is struggling because of Medicaid. And so you have to understand when our reluctance to expand a program that is making it harder for us to fund our schools, pay for our prison system, pay for the necessary environmental concerns that we have with our state, that money is going into Medicaid, which we have very little control over, particularly who receives it and how that care is delivered, although this past year we made some headway on that. The second issue is sustainability. It is $51 billion, and I agree with Pat. It's, I'm not going to be a purist here and tell you we don't participate in federal programs. Of course we do. There's a lot of federal funds that flow through the state. Medicaid is one of them. Currently, the Medicaid is a 50-50 match. And if you talk to people in Washington, for example, Paul Ryan, who's in charge of the budget in the Florida and Congress, if you ask Paul Ryan, Congressman Ryan, what do you think states should do with regards to the expansion of Medicaid? What he'll tell you is do what you want, but do not count on the 90-10 split. That is not sustainable for the federal government to pay for 90% of the cost. Most likely, it will go back to a normal 50-50 match. Well, if that were to take place, the state of Florida, at some time in the near future, would be looking at a $3 billion a year expenditure to expand Medicaid, just our portion. And so the thought that goes into that is before we jump into that pool, before I pat myself on the back, say, let's expand Medicaid and give more people access to care, and claim that it's going to give them better outcomes, which I'll talk about in a second, shouldn't we be worried about the long-term impact to the state, and shouldn't we know and have a plan for how we would pay for that? I just think that's the responsible thing to do. The third problem with it is the all-or-nothing approach that the federal government offers. What they tell us is you have to cover everyone up to 138% of the poverty rate, regardless of your need, regardless of your age, regardless of if you're a childless, single, working adult. Everybody is treated the same. Now, here's the problem. Today, there's about 800,000 people who would qualify for the Medicaid expansion in the state of Florida, somewhere in that ballpark. But almost 40%, and maybe even more than 40%, right now, this second, if the exchange were working, I'll preface it with that, they could go online and buy a private health insurance product that would be heavily subsidized by the federal government for $30 a month. $30 a month. So of the 800,000 people, about 350,000 of them today have access to care if they're willing to spend $30 a month and have the federal government subsidize the rest of that cost. And it would be a private insurance plan. It would be a Florida Blue plan. It could be a United plan. It wouldn't be Medicaid. It actually pays more to hospitals. And so my thought is, why would we subject those 350,000 people who today can have skin in the game and get private health care insurance, why would we put them on Medicaid? To me, that just doesn't even make sense. But the problem is, the federal government has not shown us any flexibility on that front. They haven't said you can target the funds to this area of need. The folks who can go buy private health care, you don't have to worry about them. We're only going to focus on people at 100% of poverty rate or below. And I want you to think of it another way too. In Florida, or in America now, if you're kind of poor, if you're a little bit poor, and you make $22,000 a year, $25,000 a year, you can go and you can buy a plan on the federal exchange, heavily subsidized, and get great insurance for somewhere between $30 and $50 a month today. But if you're really poor, and you make $9,000 a year, guess what your options are? Medicaid. Only if your state expands it. The federal government precludes you, if you make less than $12,000 a year, which is basically the 100% of poverty rate, from going online and buying a subsidized plan through the exchange. You are not allowed to get a subsidy. So if you're really poor, we're going to give you Medicaid, which we know doesn't give the best outcomes. But if you're just kind of poor, or if you're in the middle class, we're going to make sure that you have a subsidized private health insurance plan. You're creating two Americas. That's not right. That is a flawed system. And another reason why I have not been supportive. Fourth is outcomes. I mean, we could talk a lot about different forms of insurance and what's the best and what's not, but I can just tell you, if you just want to go look at the most recent Oregon study that they did, that basically came up with, after a lot of research, that people on Medicaid don't have better health outcomes than people who have no insurance. There's no statistical evidence that proves people's health care is better if they're on Medicaid. And so before we agree to putting the state on the hook for $3 billion a year, wouldn't we want to make sure that we were giving people better health care outcomes? And unfortunately, that part of the debate is not being talked about enough. We've got to spend more time talking about health care outcomes, not just insurance and who has a card that says they're covered. And then lastly, I would just say this, the hospitals, I feel their pain, because for years and years and years, they're servicing a population that is completely uninsured, and they're showing up at their doorstep asking for care. And it's expensive, and it's not productive, and it's not conducive to the way that the insurance market functions. They are a drain on the hospital system. And not only that, but a way that they paid for this bill, the way that Obamacare and the Affordable Care Act was paid for, was to health care cuts to hospitals. Medicare rates particularly were cut back dramatically. And so now our hospitals, which particularly our safety net hospitals, are in search of revenue because one of their main revenue sources has been cut back. And so to them, they need they lose money for every Medicaid patient they see. They will tell you this. They lose money. But to them, and I don't blame them, it's better than not getting paid at all. So I completely understand where they're coming from. But I just, again, feel like before we put the state at risk for taking those funds, there's got to be other alternatives. And I won't get into it because I don't have the time today, but we offered up an alternative that was authored by Representative Cummings from Clay County that offered up a free market alternative. Now, it wasn't as rich as the expansion of Medicaid. I would have to admit, it's not as much money, but we think it's a better way to go. The last thing I'll finish up on is I'll just think in your own mind about this. Does anybody actually think that just putting more people on Medicaid is going to solve our healthcare problems in this country? That that's the answer to the healthcare challenges of this country? Does anybody think that America would be stronger if we could just have more people on entitlement programs? I think most of us would say no. I say no. So my answer is then, why would we govern that way? Why would that be the way that we set the course in the future for our state when it comes to healthcare? Frankly, my party has not done a very good job of offering alternatives to the Affordable Care Act. We've become professionals at criticizing it, myself included. But my party nationally has not done a good enough job of offering an alternative. But if we were going to offer an alternative, and I hope we do, and do a better job of crystallizing what it could be, it should include things like state-driven. We are laboratories of democracy, and states are different, and the needs of Florida are so far different than what they are in North Dakota, or what they are in Arizona, or what they are in Iowa. The state should have more flexibility with how to meet these challenges. The second is that it should be focusing on cost reduction, transparency, tort reform, things you didn't hear anything about during the Affordable Care Act debate that took place in Washington, D.C. The utilization of innovation, access, technology, telemedicine. And lastly, but most importantly, it shouldn't treat the poorest people in our country differently than everybody else. We shouldn't say, if you're kind of poor, you get private health care insurance. But if you're really poor, you get Medicaid. That system should not exist in this country. And finally, the best way to get good health coverage, in my opinion, in this country, and the best way to solve this problem, is to make sure people have a quality education and that we embrace the wonderful free enterprise system that has made America what it is today. That is the ultimate answer. And if you look at the top 5 states, the biggest states in America, Texas, California, Illinois, New York, Florida. Texas and Florida today have about a combined unemployment rate of about 6.7%. Ours is just under 7, theirs is about 6.5. California's is 9.2, Illinois is 9.3, New York's is 8.7. Now, if you go look at their numbers, our uninsured rates are higher than theirs. But you know what we got them on? We have more people that are employed. And long term, to me, the answer to this problem is investing in education, investing in future generations, and investing in the most powerful tool that has changed the world when it comes to getting people out of poverty, the free enterprise system. Thank you very much for your attention. I look forward to the panel. Thank you.